messages and questions from you, some of which I didn't get the chance to answer. So I decided to make a second video and explain and answer and address those questions. You might don't care, say, hey, it's not gonna touch me. The coronavirus is not gonna happen. Flu kill more people than a coronavirus. It's really up to you to make that decision to be prepared for your family or not. I tell you personally, I've done residency for years. I have never seen anybody died of flu, nor in my family or friends that I know that died of the flu. But coronavirus has killed doctors, nurses, and all youth and young adult and all different ages. And we see horrific video, including from Iran. So it's really up to you that you want to get prepared. And for those of you who want to get prepared, here we go. I'm going to answer those questions. And the first question was N95 mask is not available. N95 mask are a thicker mask. They have a better filtration system, and because they are thick, you can breathe in from the filtering system, but when you breathe out, when it's difficult to breathe out, they put a valve, it's a one-way valve, so the air get out but cannot get in. They come in different shape and brands. You don't think that you can put this mask and live a normal life for hours or go to work. You can. It's difficult to breathe in this type of mask and not practical for daily routine life. 10, 15 minutes, 20 minutes, 30 minutes, yeah, but after that you get tired by breathing with this type of mask, but it gives you a good filtration system. The next one, alternative to that mask, is ASTM3, is a surgical mask. These are usually have 3 layers of the filtration system, and the hole for them is about 0.1 micron or about 100 nanometer, and the same as the N95 mask. And so basically they will also filter the coronavirus, but the N95 does 99%, these do 98%. I put a study that shows that there is not much of significant difference between the N95 mask and the surgical ASTM3 mask for the filtration. 1% not make much of difference. If you can't find the N95, get this one, ASTM3 surgical mask. And the price is much higher now, I understand, $100, $200, $500. Buy it. It might be the time that even at those prices won't be available to you. So for your safety of your family, I will buy that. We have testing right now, and that's why we have more cases popping up in California, and we know about it. And the Puritan transport system, we take the nasopharyngeal or sputum, so we send it for molecular biology, for RNA of this. It's a sophisticated test. We test if you have the RNA of the virus available in that swab. If it's positive, CDC does further testing. Another question was about the pulse oximeter. A pulse oximeter is a device. I put the link to buy from Amazon. Well, I don't have any financial interest. I never have financial interest for sharing my knowledge and with my friends and family, but you can purchase that. And I tell you how important it is to buy this right now. This device you put it on your finger. Use AA battery or AAA batteries, and it detects the oxygen saturation in your blood. Now, if you're suspicious of coronavirus, you'll go to the hospital. They're not going to admit you to hospital. They're going to test you. Takes 2 days to be positive. In your positive, they say stay at home. You stay at home. You're scared. You're nervous. At that time, you don't know what's going to happen, and that comes handy because this tells you how much oxygen you have in your blood. If it's going higher and it's going to go lower, you can share that with me or with your physician, and that physician can advise you better at the comfort of your house if your oxygen is dropping or not. We use this device for screening in the hospital as well. We have in emergency room, we admit a patient to hospital, lack of oxygen. We want to transfer to ICU. We check the oxygen saturation on the room to see the lungs transporting or the perfusion is okay. We get oxygen in our blood. So it's called pulse oximeter. The other thing was the sanitation or the cleaning of devices and things that we can do to clean our objects. And some of those, in our operation room, we use SaniCloth. These ones might not be available right now. The stores are empty, the shelves are empty. But I tell you this, bleach that you have it at your home, mix 10 ml of bleach with 1 liter of water. That does miracle. It's very effective against coronavirus, around that proportion. And you could put it on those top of bottle, the spray, and mix it and put it and use that as a spray object and clean the area. And there are more than 20 pharmaceutical companies racing to create a vaccine, and I think the vaccine will be available soon. and also making a medicine. But there is a medicine even in United States we can use for coronavirus. I cannot share it as a public video, but I can share it with other physicians. If your doctor has a question, they can contact me if something. Hopefully that day doesn't come, but I can share that my knowledge with them, and you if that day come. But get prepared. You know, in life, for some people are lucky and some people are not. They call themselves not lucky. And then what is luck? Luck is when the line of the opportunity meet the preparation. When you are preparation and meet the opportunity, that point called luck. If that opportunity comes and you're not prepared, then you're not lucky. And as simple as that. If you're prepared, you're lucky. Now we have multiple issues in the past, such as avian flu, Ebola, all those things. So we try to be prepared for those times, but it didn't come to the United States. It's okay. This time again, we might get prepared. It might not. It might go away. We won't have a very harsh epidemic. It will go away, and that's great. But if things get worse, we need to be prepared. Those people are lucky who are prepared, and as simple as that. I would buy food and enough supplies, masks, all these things for my family. We prepare if things get ugly. Stay at home as long as possible, and in this way we try to get more protected. Of course, if you have any question, you can contact me, and I'm sure you have a good physician and primary care doctor. You can contact them as well. Have a great day.